This is Elected, a podcast for women and our active accomplices in and around politics. I'm your host, Sarah Elder-Chamanara, and today my guest is Julia Anderson, the CEO for the Canadian Partnership for Women's and Children's Health. Hi, Julia.
Hi, thanks so much for having me.
I'm excited to chat with you today. But before we get to chatting, I'd like to take a moment in the spirit of reconciliation to share my personal commitment to learning the history of colonialism and the ongoing systemic oppression and violence against Indigenous peoples. The land where I live, work, and record from is the traditional territories of the Blackfoot Confederacy, the Siksika, Kainai, Piikani, Tsuut'ina, Stoney Nakoda Nations, Métis Nation Region 3, and all people who make their homes on the Treaty 7 region of southern Alberta. And Julia, remind me again where you're coming to us from right now.
I am in Peterborough, originally from closer to you, but in Peterborough, the traditional territory of the Mississauga Anishinaabe people.
Lovely. So thanks for taking the time to talk to me today, because I don't know if the Canadian Partnership for Women and Children's Health is on everyone's radar as much as it should be, which is probably a common issue for a lot of organizations doing critical work, is that it often, because you're so busy doing the work, there's not a lot of time for the publicity side of things. So can you tell me about the organization and what the work you do?
So for us, it's really interesting that you open in that way, because it's not actually a complete failure if people don't know about us specifically, because we are a membership-based organization of about 100 core members, and then 400 or 500 additional members as well. And these are Canadian entities like research institutions, like NGOs and charities, like health professional associations, who are all based here in Canada. So you can be based anywhere in Canada, but who work globally to advance women and children's health and rights. So the ones that pretty much every Canadian knows: UNICEF, Red Cross, World Vision. These are the organizations that form our membership. So we're more interested in our platform telling their story than telling our own story, although of course these two things are quite interlinked.
Of course, especially when it comes time to ask, government agencies for funding, and they're like, "Tell me what you do." Right?
Exactly.
That's a critical piece of the puzzle, especially on the political side of things. It always has to be tied to outcomes. So you mentioned a couple of the organizations that are linked to you. Why? So how did the organization come to be, and why? How did you end up being the kind of the base that supports all of these other organizations?
In 2010, and then again in 2016, the then conservative government led by Prime Minister Stephen Harper, really wanted to focus our international assistance. So international assistance is something that is always happening, regardless of stripe of government. As G7 nations, since it was a post-World War II kind of effort that said, how are we going to reconstruct the kind of world after that has been torn apart by war, that's good to be a part of, right? So that was the initial thinking behind international aid, and you had many organizations like Save the Children and Care Canada born at that time in a really post-war reconstruction. So fast forward, every single government since then has invested in what we call international aid or foreign assistance or development assistance. The Harper government's kind of interest was to really look at areas that were globally behind and often globally neglected by other donors. So there's a lot of donors in the landscape. So they became really curious about whether or not a smaller donor like Canada could move the needle on certain global outcomes. And the outcomes they were concerned with was maternal, newborn, and child health. And they said, not only do we want to invest in it as a primary source of our investment, we want to crowd other donors in. So it became known as the Muskoka Initiative. And really that's where CanWaCH was born, was, if we're going to invest in this single focus, We want someone sitting as kind of the umbrella entity that's pulling together best practices. And those can't just be from the NGOs. We need the research community there, who's going to, most effectively really measure whether we're maximizing effectiveness of our resources. So we want the private sector in there to be part of those conversations. And that's really going to do work that is going to move the dial. And so that's how CanWaCH was born as an organization, to really do that convening, connecting, and digging deep on how do we actually measure and the metrics for success when it comes to these really big, wicked problems, like the fact that women in poor countries, and really 99% of maternal deaths happen in low-income countries. So if you look at that, you go, seems as if we have the solution to this problem and we simply aren't investing the resources, because otherwise it'd be happening, if we didn't understand cancer kills people in all over the world, right? But maternal health is one of these situations. Newborn health, same thing, where you're born, where you're giving birth, where you're choosing to become pregnant really matters as to the outcomes you're going to experience. So we were born to tackle that big problem, and have been working ever since, with amazing members doing amazing work across Canada and across the globe.
And it's interesting that you say that, like, where you were born really matters. Also, none of us have any control over that, right? And so women who are, and people who are pregnant in developing countries, who lack the access to potentially life-saving techniques or equipment, or even medically trained professionals, they're not thinking about, I want to have my baby in Canada, right? This is where I live. This is where my family is. This is the situation that I'm in. So on metrics for maternal health and women's and maternal health, have since the founding of CanWaCH, have you seen a demonstrable shift in a betterment of the metrics?
We have. We saw over the period of 2010 to 2020 some fairly significant shifts when it came to maternal health outcomes, when it came to newborn health outcomes. So less women dying as a result of pregnancy and childbirth, more children surviving till their 5th birthday. And I think what's hard to accept now, so a very concrete example, one of the countries where Canada invested significant resources was Afghanistan. And so you saw maternal health outcomes in Afghanistan were quite horrific because of prolonged civil conflict and general poor health infrastructure, and newborn deaths were very high. And so you saw a gradual improvement with these investments. And I think Canada, there's kind of a direct link between Canada's investments and those improvements. And then, of course, as soon as what transpired a couple of years ago with the pullout of all international resources, it's just those metrics are once again slipping backwards, and slipping so quickly. And I think that's the hard thing in our work, is that the job's never done. Like, healthcare is always, we know this as Canadians, you're never done with creating and maintaining a healthcare system, because we always need one and we will always need one. And if you have countries that are highly indebted, if you have countries that for a whole host of reasons aren't able to support their own healthcare systems, the second that international assistance is removed, people don't just suffer, people die, and children die, and women die. And that's, I think, kind of hard for us to wrap our heads around, that this might be an infinite game, as Simon Sinek talks about it. It might be a long game. It's not like, if we just invest the right amount of money, everything will be okay, because the global economic system is just not that simple.
Well, and from a feminist lens, it's also that usually, where, like, these are, when it comes to oppression and agency and civil, like, human rights, and it's not men's health that's usually the first to suffer, or that these areas are critically challenged immediately, it's typically almost always in the area of women and children. So we talk about the work of improving the generally the health outcomes for women and children. Why is it so, like, obviously the former Prime Minister Harper saw a role for Canada in this space. Why is it so important that this is what Canada is taking an active approach on?
I think in the space of international assistance, I often describe aid as this overburdened Christmas tree. So every new government comes in, they throw their ornament on the tree. And since World War II, everyone's been putting their sometimes heavy, sometimes light ornaments on that tree. And eventually the thing just looks terrible and it falls over, right? Like it loses its aesthetic and it falls over, and it ceases to be effective. And I think what's really interesting about the Harper government's investments in maternal newborn child health, and then the Trudeau government's uptake of that and addition to it, which was critically missing from the original Muskoka initiative, which is that whole range of reproductive health, which people like to jump right to the abortion debate, and that's a conversation. But certainly, we're talking about contraceptives. We're talking about basic sex ed, so that people know what's what and when abuse is happening to decrease violence against women. Like, this isn't about Canada investing in hospitals that are providing abortions. This is about a woman's need for the full spectrum of reproductive care, and that her choice to become pregnant or not to be pregnant is not a death sentence. And I always say that because being pregnant is a death sentence for many women. And of course, in places where abortion is restricted or there's no access, to choose to no longer be pregnant can also be a death sentence. So what's really interesting about this trajectory is that it wasn't a new ornament. It was a continuity from one government to the next, and I hope to the next and the next, as saying, here's a point of investment that we think is highly effective, that we think is neglected by other donors when it comes to, and we know this because the Millennium Development Goals showed us exactly what you said, that the first thing to go in crisis, the first thing to go in when economic times get tough, are maternal and newborn health. They are women's health issues. And so we know this to be true. And what successive governments have said is, Canada is like this medium-sized, very wealthy nation relative to the world, can make a real difference in this one area, and we're going to continue to invest in it. That allows us to build expertise. It allows us to grow political support from all sides of the aisle, because people, when I speak to conservatives, they're super proud of that legacy, as they should be. When I speak to liberals, they're super proud of what they're doing to continue and to grow that impact, right? And so that's my goal. My goal is not any one government cares about this. My goal is that every government sees the value and kind of doesn't just tack on some new ornament onto that Christmas tree, because I think I think it's really ineffective, to be honest.
I completely agree. I mean, Madam Premier is rooted in the advocacy of the increased participation of women in politics. I think, and for me, I don't see it as one political party versus the other. It has to be a multi-partisan approach. It's not the work of only one political party to increase the participation of women and marginalized people. It has to be everyone. And, that may change as governments may change and how the tactics of that. But there has to be that ongoing work to see that done. And the recognition of it is like so fundamentally critical, because if you're like, yeah, there's no problem, that doesn't mean there's no problem.
Yeah, that's just it. And I think agreeing, sometimes, we may have different ways of articulating the path forward. We may just in fact use different language. Exact same thing.
Yep.
Which I think I see a lot of, which is just, the best thing is just to laugh a little bit about it and not get too concerned. But it can be an exercise in frustration when you're like, okay, fundamentally we're all agreeing, but sure, I'll say it that way over here and I'll say it this way over here. But I think agreeing to the problem, like you've said, is really critical. And that's what's been so key about the investment in women and children's health to date, is that we've all agreed that this problem is one that Canada can make a difference in. And we're going to be just, full speed ahead on doing all that we can.
And so I'm curious, I mean, you're obviously very passionate about this, but like, how did you come to be in this role and to do this work yourself? Was it something that was there an opportunity, or was it something that you were already involved in?
My grandparents, my Mennonite grandmother and my preacher grandfather, who were Albertan and they lived in BC, were missionaries. And so we got like tape recordings of like on cassette tape. My grandma would record her voice, talk about all these places that they would travel to and be in. And it just gave me this like hunger to be part of the world, right? Like a real sense. From Northern Alberta, we didn't really have a big picture of the big bad world. We didn't have the internet, we didn't have these things, but those cassette tapes got me curious and interested in what it meant to be a citizen of the world. And of course, the missionary kind of approach is not one that I support or am behind anymore. But this idea that, what happens to your kid is my kid, and my family is your family, and that idea of kind of the cosmopolitan sense of the world, I think, was born out of that for me. And then I studied international development. And worked at a few really small NGOs focused on health and education and gender equality, and then came to CanWaCH as it was just a really like ragtag team of 3 employees and with a big ambition to really change the world. And then we've just grown it ever since, which has been really exciting.
And I love that you put it that way, because I mean, I grew up as not in rural Alberta, but outside of Vancouver. And so a lot of the world's issues seemed like really, I mean, abstract if I even knew about them. But then once it was kind of a game changer in thinking about the world as, although something may be happening on the other side of it, that it still impacts me in different ways, or that I'm aware of it and that I need to know what's going on. And then if and when you do have conversations with people who are like, I just don't understand. So maybe they don't have that same lens to it. So like, why is Canada getting involved in, maternal health, or why does Canada care about health comes in other countries when, we've got, so many problems of our own going on, especially in the context of where healthcare is in Canada right now. But like, what do you say to someone who comes with that kind of perspective to open them up to the idea that this work really is critically important and we can address healthcare issues here in the country of our own, as well as being concerned about, women and children and maternal health and others as well?
I think I get this a lot. And I think it depends, of course, who I'm talking to, but an important first line of reasoning or kind of explanation is, why are we always pitting good against good? I always say, why are we saying, oh, well, with the 0.34% of our GDP, so that's how much goes to international assistance. Not 1%, it's not 0.7, it's not 10%, it's not 20%. It is 0.34% of our GNI goes into international assistance. So why am I taking that tiny 0.33% and saying, oh, if I only pulled that back into the economy, I could do this good over here and solve Indigenous drinking water problems, or I could do this or that? First of all, it's not true. And the second thing is, why don't we say, compare it to the budget for, I don't know, cultural and recreational events, right? Like, why aren't we saying, should we have that big
Fancy bridge,
Canada Day thing? Or should we like actually save lives and change the outcomes of the next generation of the world? Because we're always comparing, should we do good at home or should we do good overseas? And I'm like, that's the wrong comparison. First of all, we have to do both. Second of all, we have a ton of resources and no issue doing both. So we have the money relative to other countries, and we have the money. It's not going to hurt us to double our international assistance, won't touch our budgets. And so that's my first line of reasoning. The second line of reasoning, which I think is really important, is, Canada benefits from a stable world. And if you do a quick study of the last 100 years, aside from these like economic kind of spikes that happen as a result of wars, Canada needs a stable world to do well, to be economically viable, to be healthy, look at COVID, to kind of thrive in the global economy, because we're not the United States. We're not, we can't go toe to toe with big economies like China and India and stuff. We depend on a stable global order to do well. And any economist will tell you that that's true. Like Canada becomes better when the world is doing better. And so then we have to go backwards and say, okay, well, what are some smart investments to get to that better world? And what we know is when you invest in health systems, when you invest in women's health, it lifts up entire communities. And it's just this like really smart investment in the kind of world we want to see. And then of course, there's the moral argument, would you walk past a group of children suffering to the degree that the suffering exists in the world and just go, I totally have $7,000 in my pocket that I don't really need, that I can spend on another fancy Canada Day celebration. But you guys just, go on suffering. No one looks suffering directly in the face. Well, no good person looks suffering directly in the face and ignores it when they can do something about it. And so shielding ourselves from the moral opportunity, I think, is really dangerous. And I think, don't believe the scarcity arguments that are being presented by successive government after government, that Canada is we talk about have provinces and what's the other word? Have not provinces. Yeah, have not provinces. And we always frame ourselves as a have not country. And that is just factually untrue. We are a have country. There are a lot of resources to go around, and we can make way smarter decisions about the distribution of those resources and do a lot more in the world to create, again, the kind of world we want to be a part of, right?
Mm-hmm. Well, and also, my children will be growing up alongside at the same time as, children born in other countries. They're both, I want them both to be able to, live in safe, prosperous, health-oriented places. I don't see it as more for someone else being less for me, because we should be able to figure out enough that it's enough for everyone.
That's well said. And I think, people also have a bit of a disproportionate understanding about, like the chair of my board, Onome Ako, who is the president CEO of why is the name escaping me? It'll come back. And she was on a field visit recently, and met with mothers who had walked to a clinic with children, Action Against Hunger. Sorry, it's like I had Feed the Children in my head, but it's Action Against Hunger. Who had walked miles and kilometers and kilometers and kilometers to get to a health clinic, and they would bring, emaciated child dying of starvation through the sheer willpower of this mother's ability to put one foot in front of the other. And, she said, and she asked if they had children at home. And this woman said to her, I brought the child who I thought could survive, most likely to survive, right? And you think of that, or you think of Syria where it's cold, and like, it's just, if you look that in the face and then look around, there is a difference. We have there are problems here that we can solve, and we must. And globally, the picture is stark, and there are problems that we can help solve, and we must.
Yeah. My big thing is challenging people to care about issues before they touch them. So thinking about, it shouldn't take you being impacted by something for you to care about it. I think the same can be said for international aid, because to your point, global, Canada benefits from global stability. We will also, and to your other point is that, we can also suffer the consequences when there's instability at play. So, it's unfortunate though that overwhelming majority of people don't seem to care about things until it's poking them in their own face. But in terms of just to wrap up, I'm curious to know what you're seeing through the organizations that you're linked to, and what are what global threats should we be aware of that are maybe not making it their way to us through the news or through social media? What are you seeing as like an upcoming trend that you want to alert Canadians to, specifically Canadian women?
I think that hunger piece is maybe, it all depends on your algorithm, which is a crazy part about news these days. But I think that the hunger crisis, the nutrition crisis, that is really being driven by climate change and by droughts in a lot of countries. But we always and will always likely have enough food to feed the world. We just don't have the correct distribution channels for it. But I don't know that that's kind of getting, you think of the, what was it, like Live Aid or whatever that was, and this picture of just abject starvation that we saw a lot in the news in the 80s. And I don't think people quite get that it's actually worse right now, and getting worse. They kind of think maybe we've solved for that problem where we really haven't. And so again, we have all the tools to solve that problem. We just need the political will. The other piece is on the horizon. Well, and like I'm in Smoky Peterborough right now, and you were in Smoky Calgary a few weeks ago, and the environmental degradation and the way in which environment is going to start playing with direct health outcomes, and the kind of upstream solutions that we need to do for that, because where we see the most generosity from Canadians is in like immediate crisis relief. We get pretty
when they get poked. By the issue.
You see that picture, and you do, and please keep giving. It's not wrong to. Yeah. It is in fact a very human response to want to do something when you see what's happening in the world, and I encourage that. I think the other thing I encourage is just to think a little bit about how you can be an agent of change within those big, what I call wicked problems, where they're not easy to solve. They're going to take a lot of time, like the rights issues, like we need like the political issue that you deal with. Like it's not going to happen overnight that we get to parity, as much as we would like that in political representation. So I think investing in some of the thinking, investing in the people who are kind of playing the long game on these issues, I think is a really smart way to kind of balance your charitable portfolio, and the things that you care about.
Well, I think political will is such a key piece to all of this, and that it's unfortunate that when we see, political will on issues versus when we don't, and it's really driven, I think, by personal political agendas. But it's that's like a really frustrating piece. Maybe you're frustrated by that too. But that's something that, there has to be some kind of constant push on to make sure that it's whatever it is maintained. But I thank you for sharing that, because I think, you're right. It is what we see is based on what our algorithms generate. And I definitely don't think that the hunger piece is coming across in my own, in my own reading the way that it should be. But climate change, the smoke, it's been frustrating to see now that the smoke is in Ontario, and maybe this is my a little bit more of a Western lens, that it's like people are starting to pay a little bit more attention out east at the problem, because it didn't seem so critical 2 or 3 weeks ago or a month ago when the smoke was mainly captured in Alberta. So even it triggering the activation of President Biden in the States and sending like 600 firefighters to Canada, right? It's unfortunate that it takes getting poked by something to activate that sense of urgency when it should just happen.
We're working with someone in South Africa, and she had called us. I don't know. We were talking when it was really smoky here, and she's like, "Oh, I haven't heard anything about that. I had no idea that Canada was burning up." And then the next week we talked to her after it, like just a couple of days ago when it was in New York. And she's like, "Oh, now we've heard about it." And it's the same thing, Western, I'm, proud Western Canadian. So I agree. We out here were ignoring it while the West was burning up.
Well, if you talk to her again, you can also tell her that South Africa sent a contingent of firefighters that
I saw that
landed in Edmonton a few days ago. So, international relief takes many forms. If the world is burning, someone has to be there to put it out. That's not something, fire doesn't care about boundaries. It doesn't care about where you are on the political spectrum. The same with hunger, the same with all of these issues. It will happen no matter, despite if it's a conservative government, a liberal government, a Democratic government, a Republican government, a New Democratic government. It does not care. These issues will still happen. It still requires effort, right? And constant effort.
Yeah, that's right. They're forever problems. That's why, or they're forever tensions, right? And I think that's not, people don't like to think about it that way, but that's just the reality of it. And I think that's why we need to cater our kind of interventions, our investments to really recognize we're like a partner, like South Africa showing up here, like we're a partner in this, we're co-creating the kind of world, the kind of globe that we're a part of.
Yeah.
And borders don't really matter in that context.
Agreed. Well, I want to really thank you for taking time to talk with me today. I think it was really lovely to hear your insights, and hopefully to put this on the, make it more top of mind for people. And also, if anyone is listening and, is in those similar situations where you're having conversations with someone who's like, well, what about this? And I think it's also good to give people the tools and, messaging to be able to still have thoughtful conversations, but also be able to push back and maybe even change minds, hearts and minds as well, because I think that's especially on these things, it's not just hearts, but also minds.
Absolutely true. I'm a big supporter of yours and of the podcast as a mechanism, because it really is a conversation. And I believe that's our number one pathway to changing the world is having conversations. So thank you for having me on. And everyone can check out our website, canwach.ca, canwach.ca. And from there, go to our members' websites who are all doing the amazing work.
Thank you so much. I hope everyone does that. So thanks again, Julia, and all the best.
You as well.